We bring you a special report today as the governor brings us another update on the state's fight against the coronavirus. He just stepped up to the podium. Let's take a listen.
Your questions, and I think he's got a couple of questions from the public that he will start off with today. I also have Lieutenant Governor Billy Nungesser, who's going to give an update on state parks and anything else that he's got going on that he wants to share with you. And so what I'm going to do is, before I get into the most recent testing and so forth, I'm going to turn it over to the Lieutenant Governor for his update. I would ask that if you have questions for him about his presentation or whatever, that you go ahead and get those questions asked while he's at the podium. I'll then come back up and deliver the rest of my prepared remarks. But I thank him for being here with us today and his partnership and the work that he's done throughout this public health emergency. But Billy, come on.
Thank you, Governor, and I want to thank your team and all the committees working to get us to where we are here today. There's been a lot of hard work behind the scenes made, and to get us to where we can finally get back to enjoying Louisiana. This Friday, we will open 18 of the 21 state parks, 18 historical sites, and we are going to cancel all of the out-of-state bookings through the phase one. However long that lasts, the parks will only be able to be enjoyed by Louisiana residents. So we have a lot of cancellations and a lot of room for Louisianans to go out and make a reservation to stay at a state park. We're going to offer a little lanyard. If you book 3 nights at a state park, campsite or a cabin, you'll get the 4th night free. You can go to louisianastatepark.com, and the promo code is welcome back to get that 4th night free. So we're encouraging everybody to get out and enjoy those state parks. There's a lot of trails, fishing. We've got historical sites like Poverty Point. Great things for us to get out and enjoy. There are 3 state parks: Chico State Park in Ville Platte, Lake Bisono, between Shreveport and Ruston, and Bayou Signet on the West Bank, that the team is still using to house people that are symptomatic. And we're going to keep those places closed until we can work out a plan. And we are working on a plan to get portions of those parks back open as soon as possible, and we'll keep you updated. We're asking everyone to please follow all the guidelines set by the governor's team. Our park rangers and attendants will be there to help you, but we will also be there if we see large gatherings to make sure we do this in a safe and proper manner so we can get moving through these phases as quickly as possible and welcome tourists back to Louisiana. We're also going to be opening Saturday our non-state museums. Those museums have many new exhibits throughout the state, and if you haven't reached out and been to them with your children, it's a great, exciting time to see all the new exhibits at all the museums. You can go to louisianamuseum.org, and our teams will all be wearing masks, cleaning the facilities many times a day, a sanitizer throughout, and make sure our teams make it as safe as we can for everybody that's visiting. The welcome centers. We are going to keep the welcome centers closed until we get into the next phase where we can invite visitors back to Louisiana. The restrooms at the welcome centers will remain open, and we're cleaning them many times a day for people that are traveling and need to pull over and use the restrooms. Our state parks and museums, coming off our 4th record-breaking year, incredible numbers throughout Louisiana. Last year, 53.2 million visitors came to Louisiana. Incredible year, 4th record year, and I know we can get back there soon if we all work together and follow the rules. This has been an incredible journey. You know, Louisiana has been through hurricanes, the oil spill, the 2016 floods that flooded 57 to 64 parishes, and through it all, they didn't know if we'd come back. And yet we've come back stronger each year with record-breaking years. So I know we'll get through this working together if all Louisianans listen to the rules and we all pull in the same direction. So thank you, Governor, again for having me here today.
Lieutenant Governor.
Man, I like that.
Must be saving up for me.
Thank you, Governor.
Appreciate you. Thank you, Lieutenant Governor. And I will tell you that his partnership in terms of the 3 state parks that have been used to house individuals who might be under investigation or COVID positive, but they either can't go home because they have a vulnerable family member living at home or because they might be homeless, has really been extremely helpful, because we've had those in 3 different locations across the state, and it has been very, very helpful for those communities, for those families, and for the state as a whole. And I appreciate his partnership and the time that he spends at GOSEP, especially when we are on a video telephone conference with the White House Coronavirus Task Force. So I do appreciate you, Billy, and everybody in your office. As I announced at my last press conference on Monday, obviously this Friday we're going to be transitioning away from the stay-home order and to phase 1 of the reopening. More guidance is forthcoming from the State Fire Marshal and from the Louisiana Department of Health. It will be available for everyone to access through opensafely.la.gov, opensafely.la.gov, once everything is finalized, which will be very soon. As we broaden the category of businesses that can begin to reopen and receive patrons again, there are obviously a lot of details that have to be worked out, and we're working through that now and sort of figuring some of this out as we go. You know that the stay-at-home order put restrictions on some businesses, and those restrictions began more than 7 weeks ago. As we carefully re-engage businesses, as we move through the phased approach to reopening that's set forth in the President's guidelines for Reopen America, we obviously have to make a lot of decisions about how to strike the right balance between public safety on the one hand and getting those businesses open and employees back to work on the other. And obviously to do that, we're incorporating feedback that we're getting from the business community itself, from the task forces that were created in order to study these things, as well as from health experts. The bottom line is that we want the best guidance possible, obviously not the quickest, and all the guidance will be finalized before I sign the order tomorrow. And remember, I will sign the proclamation tomorrow that officially lifts the stay-at-home order, moves us into phase 1. That proclamation will become effective on Friday. And I will speak in more detail about this at the press conference on Friday. And obviously this process is playing out this week as the one we envisioned, which is why we wanted to make the announcement on a Monday as to what would happen on a Friday, so that we could use the intervening days in order to hammer out all the details. In addition to sharing information on the Open Safely site that I mentioned just a moment ago, it's also going to be available at coronavirus.la.gov. Nearly 8,500 businesses have already registered, and while it's not required for a business to register in order to open, it is suggested that businesses do that to make sure that not only do they get this information, but that updates would automatically be sent to them by email, whether the guidance changes for some reason or as we move forward into the next phase, those measures can also be communicated to members who sign up. But it is not necessary for any business or for churches, for that matter, to register on opensafely.la.gov in order to reopen, although you do have to follow the proclamation. As we move into today's testing update, I want to share with you in advance that the number is not quite what it seems. So we're reporting 612 new cases today for a total of 32,662. As happened a couple of weeks ago, we have 3 labs that are reporting for the first time today. These are 3 point-of-care labs that have results that go back several weeks that are all being reported today. And in fact, 317 of those 612 cases that we're talking about came from those 3 labs. So if you take those cases out of the mix, there are 295 of the 612 which are really new and in the last couple of days. We expect to see more labs coming on board in similar fashion as we ramp up testing, but we're doing everything we can to get them to electronically transmit daily results so that this doesn't happen. Sadly, we are also reporting 30 new deaths, which bring us to a total of 2,315 for the state of Louisiana. I also want to point out that yesterday, while we didn't have a press conference, we released new numbers right around noon. There was also a data error in hospitalizations that actually came from one of the hospitals in Region 9, and it was an input error. They hit the wrong number. And so if you looked at hospitalizations yesterday across the state, it looked like hospitalizations had increased. In fact, once we fixed the error, they decreased by 65 yesterday to 1,245. And the good news is that they decreased again today by 51. And so the current number of hospitalized COVID-19 patients across the state of Louisiana is 1,194. Oddly enough, vent usage went up by 1 today to, I think it's 147. One of the more impressive numbers, for me at least, because I know where we were when this started and so forth, is the fact that we now have completed almost 238,000 tests in Louisiana. And I did want to pause and just point that out and ask people to realize how far we have come in testing here in Louisiana. We did our first test on on February the 28th at the state lab. The commercial test actually didn't start until March the 12th. So now that we're almost 238,000 tests, and capacity continues to grow rapidly. And we're working with our federal partners at the CDC, at Health and Human Services, and at the White House in order to make sure that we ramp up that capacity as quickly as possible, have the best possible strategy in place for testing, and in accordance with the White House's recent nationwide call for COVID-19 testing in all nursing homes for residents and workers alike over the next few weeks, we are working on a plan that will accomplish that goal. We've known from the beginning that nursing homes are one of the places that are most conducive to the spread of the virus, and unfortunately it is inhabited by residents who are most vulnerable to the virus. And it's a particularly challenging situation because obviously people are in nursing homes because they need help. They can't care for themselves, and so you have staff that are going back and forth, and they can inadvertently introduce the virus into that particular facility, and they can do so while they're completely asymptomatic. And I guess that's one of the most challenging things about this particular virus and this particular public health emergency. The individuals who are either mildly symptomatic or asymptomatic, they have no idea that they have this virus, and yet they can be contagious. This past Friday, the Department of Health issued guidance on testing for COVID-19 in nursing homes, long-term care facility, and other congregate settings. And as the capacity for testing increases and allows, facility-wide testing of all residents and employees will happen in those facilities. And this testing in congregate setting is recommended for individuals with symptoms and individuals without symptoms as well. But we only need the comprehensive testing in those congregate settings. We not only need comprehensive testing, you got to have a schedule for repeated testing, so that once you get 100% of the residents, 100% of the staff, you then got to go back periodically and test again, and you especially have to test the staff who are going and coming into those facilities on a daily basis. I'm happy to report that we're already seeing progress, and in fact, the Louisiana Department of Veterans Affairs, working with the Department of Health, has been testing, and in some cases retesting, residents and staff members of all of their facilities, which means that by the end of this week they will have completed testing, I think, everyone in their system, staff member and residents across all 5 homes. This has also happened in several homes across the state of Louisiana as we were apprised that there were particular challenges in those homes. The Office of Public Health did work with a number of homes to make sure that everyone could be tested. It has not happened at every home across the state. That is what we're currently working on. And each region of the state, in terms of the LDH regions, led by the medical directors of those regions, have created strike teams to be able to go in and help nursing homes with whatever issues that they face. And that certainly includes testing. Since Friday, Region 5 in southwest Louisiana has successfully worked with a local facility to deploy its regional nursing home support team, which provided on-site assessment and technical assistance on best practices on infection control. Technical assistance team included the Office of Public Health, ESF 8 Coalition, that's Emergency Support Function 8, which is the term of art in GOSEP, and infection prevention staff from local hospitals. Part 2 of the strategy is testing, which the region has continued over the past couple of days in partnership with the National Guard, the Office of Public Health, and the state lab. In total, 286 tests were done, 136 on residents, 145 on full-time staff, and 6 on part-time staff. And I went through this particular region to give you an idea of what we're doing in every region. And in fact, it was Region 7 in Shreveport that did this first and got well out ahead a few weeks ago. So ramping up testing for COVID-19 across the state is obviously a critical component for us going forward. We've gotten a lot accomplished since the start of the pandemic, and I'll be the first to tell you we still have a ways to go. We're going to continue to ramp up our testing capacity as quickly as we were able to do so, and we are getting good support from our federal partners. And I can tell you at this point they are fully on track to resource us so that we can conduct the 200,000 tests in the month of May as per our plan that we gave to them that they approved. And we're going to be focusing more and more on those areas that have had inadequate testing to date, those areas that we consider to be hotspots, and the congregant settings, as I just mentioned to you. Equally important, the Department of Health is building up capabilities to enhance contact tracing. On Monday, I mentioned that the contractor that the state has retained in order to set up these call centers and begin contracting would be hiring. Within 24 hours of making that announcement, there were more than 2,000 applications by individuals seeking employment as a contact tracer. And I'm asking these individuals to be patient. Obviously, we're not hiring 2,000 people. We hope not to get to 2,000 total, but we're certainly not hiring 2,000 up front. And so be patient as we get through the applications, and positions may become available in the future as well and through vacancies, and those will be posted on ldh.la.gov/contact tracing. So I would encourage those individuals who are interested to check that site frequently. Finally, I want to remind everyone, and we haven't talked about this in a while, the 2020 census is still underway. It may not seem like much of a priority right now, but for the individuals who are spending more time at home than ever, we really need you to take the time and make the effort to be counted. Critically important that everyone in our state participates. It's confidential. It only takes a few short minutes to complete your response. By now, you should have received your 2020 Census invitation letter, and responding will minimize the need for the Census Bureau excuse me, to send census takers out into our communities to follow up. The self-response rate in Louisiana is just over 53%. It's right at 59% nationally, so we're lagging behind. We've got some work to do to get our numbers up. And remember, your participation will help determine our representation in Congress, our share of federal resources and funding, and many other things as well. So during this period of staying at home and social distancing due to COVID-19, One of the most important things you can do is to respond to the census. You can do it online, by phone, or by mail. The self-response deadline is October the 31st. So encourage your family, friends, and community to get involved and self-respond to minimize the need for census takers to follow up, and also to minimize the chance that you are not counted. Everyone in Louisiana counts. If you want more information, you can go to my2020census.gov or call 800-923-8282. So our primary challenge right now, as we conclude our prepared remarks today, is to keep moving in the right direction while gradually re-engaging our economy in the phased approach called for in the White House guidelines. That's what we intend to do. I am confident that we can be successful. But just like every individual across the state of Louisiana has had a role to play over the last number of weeks, that will continue to be the case. And so as we bring more businesses back online, bring more employees back into those businesses and customers back into those businesses. In short, as we make more contact with one another across the state of Louisiana, the way you keep the cases down is to wear your mask, be a good neighbor, wear your mask, make sure that you keep 6 feet distance from yourself, between yourself and individuals who are not part of your immediate household, and engage in the hygiene practices that we've been talking about, washing your hands frequently. And remember that extreme caution should be exercised by those members of our community who are more vulnerable to this disease by virtue of their age, 65 and older, and because you may have one or more comorbid health conditions that render you vulnerable to this particular disease. So would you ask you to keep all of that in mind, do your part, and if you will, we can successfully move to phase one as we re-engage more and more of our economy without having our cases shoot up in a way that we can't keep under control. And so I'm just asking everybody to pay attention on that. And let's continue to help each other. Let's continue to be good neighbors. So we've got a couple of questions today. I'm going to yield the podium and allow Dr. B to come up because both of these are more of a medical nature. But Blake in Shreveport asked, why aren't tattoo shops in phase one? I did not include them in my order because of the recommendations, the counsel that I got from the medical professionals here in Louisiana that I am working with, the principal one of which happens to be Dr. Bu. So he's going to come up and talk about that and answer the second question coming from Sherry from Lake Charles. And then if you've got questions for Dr. Bu, I would ask that you ask them at that time, and then I'll come back and take your questions when he is complete.
Thank you, Governor, and thank you, Blake. So I think this is a great question to give me an opportunity to talk about how we came up with recommendations that we made to the Governor about what should be in phase one as we think about relaxing restrictions. We followed the principles and the approach that was recommended by the American Enterprise Institute and Johns Hopkins, and really thinking about 3 factors when you're thinking about different sectors or different facilities or organizations and the safety involved in engaging them. So the first is the number of contacts. The second is the intensity of that contact. And the third is our ability to modify that contact. So if we think about number of contacts, there's a difference in the risk for the spread of COVID-19 between a situation where maybe one person is coming to a counter at a time and a situation where many people are huddled together in a line or in some sort of group activity like on a parade route or in a pool. If we think about intensity, what we mean by that is we've talked about how we define a close contact using CDC guidance. That was being less than 6 feet for greater than 15 minutes. And so the idea is we call something more intense if you have to be in closer contact and for longer periods of time. And then modification comes down to what measures can we take, what personal protective equipment, what physical barriers, what other barriers or engineering feats can we do to reduce the risk of COVID-19 transmission in that setting. And so looking at all three of those factors, we then went literally sector by sector to understand what is the level of risk. Is this a low-risk setting once we do maybe some modification? Is it a medium-risk setting? Is it a high-risk setting? It was not an arbitrary decision. It was done with internal public health experts, with representatives from across government, and with the governor's Resilient Louisiana Task Force, representing sectors across the state, understanding how they can modify their own businesses or sectors as well. And when doing that, you can imagine how something like tattooing, where you have to be in close physical contact for an extended period of time, and there's a challenge then to managing or modifying the risk of transmission, would be not in the lowest risk category. And again, phase one is really those low risk sectors that we're opening up, wanting to start first with the places where we have the biggest opportunity to restart, re-engage the economy without putting the public at undue risk. That's something that we had to balance throughout the development of this of these recommendations. The risk from COVID and the risk to the economy and to the livelihood of the employers and employees of these organizations. And we had to certainly draw the line somewhere. And unfortunately, tattoo shops are not in phase one, but we're hopeful that when tattoo shops do reopen, people can go back and take part in those activities. And we'll look at the next question. So Sherry in Lake Charles asks, should I be concerned about more businesses opening up? So maybe the follow-up question to where I just landed. So as we said on Monday, looking at people showing up to emergency departments with symptoms of COVID-like illnesses, the number of cases that we have in context of the increase in testing that we have going on, the proportion of those tests that are positive coming down, and overall our hospital cases coming down, we felt that we had the ability to move into phase one, that we could start re-engaging aspects of the economy. Again, balancing the risk of COVID with the risk of the economy continuing to not be engaged, and these businesses and employers and employees suffering from economic challenges, which frankly do lead to health challenges. We know that it's not just COVID that we have to worry about when we worry about health. And so for that reason, we feel that we can move into phase one on Friday. But I think this is an important point to make. That's not to say that we are out of the woods. This is what you heard from the governor on Monday. This is not mission accomplished. This is not a return to life before COVID. This is re-engaging low-risk settings where we can modify the risk to the public for us to then go back to those businesses and facilities. I'll also point out that over the last 9 weeks, again, you just heard the governor making a point of how much testing has increased over the last 9 weeks. I think it's also worth noting we've moved from March 9th having 1 case of COVID in the state to 9 weeks later having more than 33,000 people infected, the vast majority of those that happened under a stay-at-home order. And what we're talking about now is moving beyond a stay-at-home order and re-engaging. And so that should give us all pause in thinking about, now if I'm going back to engaging those businesses, how am I going to do that in a way that minimizes my risk? How are they going to do that in a way that minimizes my risk as I engage with them? And that's where the guidance that you'll see on open safely is really key. We're all going to have to change our behaviors, sometimes to a small extent, sometimes to a large extent. Wearing of masks needs to become something universal that we're comfortable doing, especially when we're around people who are not our immediate household members. We need to take serious the guidance that if we're not feeling well, if we're ill, we need to stay home. We don't need to be going out to a restaurant, certainly, if we're not feeling well. We also shouldn't feel offended if that restaurant asks us, have you had symptoms? The same screening questions that we get when going to business. Have you had symptoms? Have you had a fever? They're not saying anything about you. They're trying to protect you when you go out to enjoy your meal. And so we should welcome that. We should feel that that's kind of what we want our businesses to do, to open safely. And then we should all take part in washing our hands and supporting the cleaning of surfaces that we touch and all of those things. But we should also remember that though we don't need to stay at home, we are still safer at home. There are still more than 9,000 cases of COVID-19 statewide right now. And so while you should engage with these sectors, we do want to re-engage the economy and come out of this period of really a challenging time. We also need to keep in mind we should not be spending all of our time every day going to a restaurant, going to these facilities. You need to balance your own risk and your ability to limit the spread of COVID at the same time that you are able to go back and do some of these things that you may have been really wanting to do but not able to do. I guess my request to you is don't go and do that every day. Continue to remember you are safest at home during this next phase. So happy to take any questions with that. Leo.
The hotspots still seem to be in Northeast Louisiana.
So yeah, I'll say we have hotspots. So if you go to the LDH website, we go down to the census tract level. And I'll note that when you look down to the census tract level and we have this heat map that shows you the intensity of positive tests in those areas, you'll see that there are hotspots throughout the state. And certainly there are areas that we're concerned about in aggregate. When we talked about the north with the Shreveport-Bossier area, or sorry, the Caddo-Bossier area and the Monroe area, still, seeing elevated hospitalization rates, but I would say that we can do more in communities across the state, identifying and going in testing, and contact tracing is going to be a key part of that. How do we focus our efforts on individuals who are clearly coming in contact with each other and with COVID, and then get them to be quarantining and isolating so we don't see that spread going on in small communities and large. So again, we already have contact tracing that's ongoing with our group of 75 uppies. We are training up our cohorts, and our aim is to have 250 or more by Friday ready to start making phone calls and reaching out to you. And again, don't want the public to be surprised if you get that call, and they're going to give you lots of good advice on how to reduce your risk, how to understand your risk, and how to stay at home.
On that subject of contact tracing, can you walk me through again how you went from the 700 number y'all were previously talking about to now what looks like about 300, 320 that y'all are going to end up having?
Yeah, and we'll have to see where we end up. And I think, to the governor's comments about, 2,000, what we're looking for is the ability to scale as needed. There's a lot of factors that go into how many contact tracers you need. The 700 was based off of looking at Massachusetts, which we previously said had about 2 weeks lead on us on setting up their system. And just looking at the number that they had and looking at our population, crude math gets us to needing about 700 people. But obviously there's big differences between Massachusetts, a relatively populous, concentrated state, and Louisiana, slightly larger and less populous. So when we look at what we're going to need, we're going to have to understand how do we meet our goals. One of our goals is to contact every individual who's tested within a 24-hour period the day that we have their result. The next is then to contact their contacts and to reach really 3/4 of their contacts within that same period. Right now, when people are staying at home, our contacts are pretty small. Most of our contacts are going to be household contacts. It's very easy to move through those cases. When we start to re-engage these sectors, when we start to move about more, we're going to see contacts go up, and it's going to be more phone calls, more time that's taken. And so all of those things have to come into measure as we think about how many people it takes to make sure that on a daily basis, on a rhythm, we're reaching out to everybody that needs to be reached out to and giving them the advice that they need. And so right now, we're anticipating we'll have at least 250 on Friday. The method that we've taken, or the approach that we've taken, contracting with now 3 different call centers, them doing, hiring, us doing training, and a pretty rapid training as well, is going to allow us to quickly add large numbers. Again, our goal is 250 by Friday, but we think we can add, another 100 in a week, probably much more than 100 in a week if needed across those call centers. So I don't know, Melinda, where that number is going to land, and it may change over time, especially if, as our goal is, we start to see less COVID in the state. There will just be necessarily less work for them to do.
And the guidance that you sent to nursing homes on mass testing, were prisons included in that? And if not, why not?
So we said all congregate settings.
Okay, so all the guidance you sent to nursing homes also applies to prisons?
All congregate settings. So any adult facility, any place where you have large numbers of folks living in close quarters. So dorm rooms as well. But right now, dorm rooms aren't active.
How do you ensure that these facilities have the resources, capabilities to test? And you mentioned going into nursing homes with LDH officials. Are you also doing that in prisons if necessary?
Yeah, so where they have medical professionals doing the testing themselves, we don't necessarily have to go in. But I'll say across all of these settings, That's been the work that we've been doing and we continue to do. That's as we identify that an individual that's has COVID is in one of those settings, we don't just sort of stop at that individual. We are really talking to those facilities and doing this intensive infection control assessment and response plan that we've talked about in the context of nursing homes, but long-term care facilities and prisons. It also comes up. And that's talking about personal protective equipment, that's talking about protocols and ways to reduce the spread. And now what we're able to do is surge a little bit more the testing that will also identify the asymptomatic individuals that we know can contribute now to spread in those settings. So any congregate setting, our desire is to have that same approach taken where we're really systematically testing and, as the governor said, retesting. That's going to put a big burden on testing, but thankfully, we have the support from the federal government. We also have support from a variety of health centers and private labs across the state to help us meet that demand for testing because it's really critical.
Assuming you don't need to do contact tracing in these congregate settings, right?
Well, often contact tracing is what leads us to that setting where we don't have the setting, report to us, quickly enough. Sometimes they get to us before we get to them. Sometimes we get to them before they're even aware of a case. If, for instance, their resident was diagnosed in a hospital, they may not know yet the result. We get that pretty quickly. But you're right. I mean, I think it's pretty clear then at that point, this is a facility and we need to really just treat it as a congregate setting, not as calling those contacts individually.
This
Please.
would be for the governor, but we're hearing some people voice concerns about your privacy when it comes to contact tracing. What would you say to those people?
Can we take a
You
first
take a
step?
stab
Sure. So we understand. I mean, part of the work of public health has always been to protect privacy and information. When we do an epidemic investigation, we are really not talking to the public about, hey, did you hear so-and-so had this infectious disease? I think COVID-19 has put us in a position where we're doing a lot more talking about who has COVID, who doesn't, and now really, entire neighborhoods and communities where we need to be sharing information about who's at risk. And so I say that to say that the approach that we're going to take with contact tracing is one that still endeavors to the greatest extent possible to preserve and protect that privacy. So the systems that we're using, the training that we're doing, the health informatics systems that underlie it, all meet the HIPAA requirements, and that's the hospital level, healthcare level, data protections that should give us some confidence that that information is being protected. We're training folks to know that when they're talking to somebody, they're talking to somebody almost as a healthcare professional, where they can't go and tell after their day of work, hey, did you hear about, or can let me tell you about this case. And so we understand that even with that, some people are going to be anxious about us reaching out, and we wouldn't do this, we wouldn't do all of the stuff we're doing right now if it wasn't such a public health need and an important aspect for the public. So what I'd say is we understand that concern, but this certainly rises to the level where we think we need to be reaching out to folks, and we hope that they appreciate that we're doing that out of their interest and out of the interest of their communities as well. Okay, thank you.
Thank you, Alex. And I will tell you that individuals obviously have a privacy interest. They also have an interest in knowing whether they have come into close contact with someone who has COVID-19. It benefits not just them, but their family and the people that they would otherwise come in contact with. And so, it's everything about this public health emergency demands that you do your very best to strike the balance between competing interests. And that plays out in a variety of ways, including this privacy interest. But we need to make sure that people know if they've come into contact with someone, because we know that the overwhelming majority of people want to know that, and then they're going to act responsibly when they get that information. And that is going to be critical to us moving forward and keeping the cases down. And Melinda, it may have been me who initially said that we were looking at 700. I always believed that to be the upper limit on where we might get, and I may not have communicated that effectively when I put that number out there when it came to the number of contact tracers. I knew that it came from a model that was based on Massachusetts, but did not intend to say that we were going to start with 700, but that we thought that we might have to get as high as 700 if that particular model proved to be, reliable. Yes, sir.
Governor, the Lieutenant Governor mentioned these 3 isolation sites you guys were using at the state parks. Can you just talk about the status of the isolation sites and and also the Ernest Memorial Convention Center, and any other facilities you may have stood up in the early days of the outbreak.
Yeah.
What's being done with them moving forward?
So of the sites that we have stood up, I can tell you the one that is no longer being used at all, in fact it's gone, is what we call the PHU, which was across the street from the Morial Convention Center. We stood up sites at Bayou Signet State Park, Lake Bistineau State Park, and Chico State Park. And we put campers there, and they also have cabins, and this was obviously in partnership between GOSEP, the Department of Health, the National Guard, State Police, DCFS, and State Parks. And we did that with campers and cabins so that we had a place to put individuals regionally if they tested positive for COVID-19 and couldn't go home, either because they didn't have a home to go to or because they had a family member living in that home who was vulnerable to disease and they wouldn't have the ability to isolate in one part of their home. And we have used all three sites for that purpose. We've also used it for the purpose of allowing individuals to quarantine if they were a PUI, meaning that they were symptomatic, they had been tested, but we didn't have the results yet, but we didn't feel like they should be out in public. We would also put them at these three camps, I should say these three parks. And that has worked very well. All of those parks remain open. In fact, they all have a small number of individuals at them today who are using it for the intended purpose. And in order to give us flexibility as we move forward, we're going to keep those three parks open for that purpose with those travel trailers. And because we have been told that, and certainly we hope it doesn't happen, but this particular virus could flare, and we could have a resurgence of cases, and they could spike, and we need these trailers again. And so in order to maintain the flexibility that we have and not have to go through the process of creating these sites again, we're going to leave them in place in continued partnership with the Lieutenant Governor, even as we try to get other aspects of those state parks back into operation, something that we're currently talking about. With the Morial Convention Center, we are in the process now of coming up with a phased approach to taking the hospital beds out of the Morial Convention Center, but doing so in a way that for the next several months will leave a nucleus of beds in there so that we have that flexibility as well. You will remember the Morial Convention Center was stood up as a hospital facility so that the less acute COVID patients could be transferred out of the Region 1 hospitals, and ultimately the Morial Convention Center was also going to serve this same purpose for Regions 3 and 9 as well, so that they could be transferred out and rotate their acute care beds, their ICU beds, their not necessarily the ventilators, more frequently. And so that's what we did. I know that we're well over 200 patients. I don't know what the exact number is. I know we're well over 200 patients that have actually been treated at the Morial Convention Center. I think today there are 17. And so what we're going to do is we're going to go through a process over the next several months, but it's going to start really quickly to move if you remember when you see this, it's basically a tent with a roof on it and then a wall around it and all of the things you would typically see inside of a hospital room. Those things will start coming out, but we will leave a couple of wings available there, again, to give us more flexibility going forward. And so that's what we intend to do with the Morial Convention Center.
How many beds you're going to leave?
You know, I apologize. I was briefed on this morning, and by the way, what I was briefed on was a draft plan that hasn't actually been formally recommended to me. So there's two problems with me answering your question. I don't remember what they said, but number two is I haven't pulled the trigger on accepting their recommendation. Yes, ma'am.
A lot of business owners who own bars have been applying for food licenses for running into some problems, I guess, if they want to be able to open during phase one. What are your thoughts on bar owners doing that? And do you know why
Well, look, if a bar has an LDH food permit, we've said that they can open, but under the same parameters as a restaurant. So they're not going to function as a bar. They're not going to have people bellying up to the bar and standing around and so forth. If they're going to have people inside being served, they're going to be seated at tables. They're going to be social distancing and all of those sorts of things. And if a bar is able to apply for and obtain a permit for food, then obviously it can open in that fashion. And if they want to do that, then I encourage them to try to do that. I don't see any problem with that. But what we don't want to happen, and this goes back to the exact same discussion that Dr. Bu had a while ago with respect to tattoo parlors. There are just some settings that are inherently more risky than others about transmission of the virus. And bars are one of those, and it's unfortunate. We do hope, obviously, that at some point, as we transition in phases, that we get to reopen bars, and we'll do so in a way that's safe and responsible. You might have seen in the news over the last week or so that in South Korea, they had all of their cases under control through their testing and their contact tracing, and then all of a sudden, they had to close 2,100 bars in Seoul because the contact tracing pointed out that that's where the cases were coming from when they spiked back up. And so we don't want that to happen. And look, these are tough decisions. There's not a conscious effort to be harsher on any particular type of business other than the risk that it poses to public health, just because of the nature of the business. So if they can do that, I encourage them to do that, but then I insist that they operate in a way that has been set forth, just like the restaurants will do, so that people can go to those establishments and be safe.
Should they be going through the ATC because the ATC has been sort of...
I'm sorry.
Should they be going through the ATC to do that? Because apparently the ATC has been pretty harsh on these.
Well, they're going to have to get the permits from the LDH in order to have the food permit, and so that's not somewhere they should go to ATC for.
Last one.
Yes.
Governor, Commissioner Darden said he'll present your recommendations for the budget this week, by the end of the week. What are going to be your recommended cuts? I mean, I know you're hopeful that the feds will end up somehow later filling in, but what will be your recommended cuts?
Well, we're going to present those recommendations later in the week. If I were going to present them right now, I would tell you exactly what they were, Greg.
Does that mean we get another question? If you're not
Yes. Since that wasn't a good question, we'll entertain one more.
There are several bills that are floating around right now, and in like the Louisiana legislature, but also these have been floated in other states about limiting liability for businesses that reopen, for nursing homes that have treated COVID-19 patients. Where do you stand on those ideas? Is that something that you would be interested in pursuing for Louisiana?
Well, it's certainly, I'm interested in looking at the bills. You know, it's still relatively early in the process, even though we're well into the session, but because they recessed for so long, the bills are just now starting to move and to be amended, and so we'll be taking a look at those. This is not just going to play out at the state level, and one of the things that will be interesting is to see the degree to which the Congress incorporates into subsequent CARES Act. You know, if there's a CARES Act 4.0 or some other bill, it looks like Leader McConnell, Majority Leader McConnell in the Senate, and the President will insist on some of those tort immunities in exchange for more relief aid, for example, for local government, for states. And so we have to see how that plays out. And sometimes when they do that, they will preempt the field. And so there's a long way to go on this, Melinda, and I can't tell you exactly where we're going to end up. But obviously we want people to feel safe when they go to work. We want them to feel safe when they re-engage and go into a business as a patron or a customer. And it certainly is inconsistent messaging if you say you're going to do something in a safe way, but you insist on immunizing yourself from any claim that might occur. But this is such a peculiar situation with this public health emergency because I don't know how anyone ever meets a burden of proof of establishing where they were exposed to the virus, especially since they can have the virus for many days before they become symptomatic, and they're guessing it where they got it. So what I'm encouraging businesses to do, and everybody, not just businesses, but anything, any facility, any establishment open to the public, is to do everything you can to embrace the CDC guidelines, the things that we put in our proclamation, make sure that people are safe, whether they're the people who work there or customers or others. That's the most important thing, and we'll work through these immunity issues over time. Look, I want to thank you all again for covering this, and our next conference, press conference, is scheduled for Friday, same time at 2:30, right here. And I want to continue to encourage the people of Louisiana who have done a remarkable job. I got a briefing this morning from LDH. In fact, I get this briefing just about every single day, and we actually have some regions in Louisiana that are currently trending below a 1.0. So what that means is, as we gather here today, there are sections of our state where the virus is on the way to, I don't know what the right word is, eradication, disappearing, because any R naught of less than 1 means that the transmission is declining and not growing. And so we've made tremendous progress from where we were a few weeks ago. And it's not because of any orders that I've issued. It's not because of the eloquent way that Dr. BU can explain this virus and this disease and how it's transmitted and what duties we owe one another. It's because the people of Louisiana have taken it upon themselves to be good neighbors and to do what is necessary. And I'm just going to encourage you to continue to do that. Do that for tomorrow as we go through the rest of the stay-at-home order, and then starting Friday as we go into phase 1, to continue to do what you can. If you're vulnerable, stay home, unless you absolutely have to get out, and then go out and do it no more frequently than is necessary, and then come back home. And then if you're not one of those most vulnerable people, you still need to be wearing a mask when you're in public, outside or inside, and in close proximity to others who are not in your immediate household. You need to make sure that you're washing your hands frequently and keeping 6 feet distance between yourself and others. That's how we continue to have an R naught of less than 1, even as we reengage sectors of our economy. It can be done, but it depends on how we do it. If people will do what the CDC is recommending, if people will do what the Department of Health is recommending, if people will do what's going to be in this proclamation tomorrow, we can continue to have tremendous success on the public health front while we reengage our economy. But if people get too anxious, if we lose patience, if we're inconsiderate to fellow Louisianans, then we can go in the wrong direction. That is the worst thing. Not just with respect to public health, that's the worst thing you can do for the economy, because then you're going to have to slam on the brakes and you're not going to be able to transition into subsequent phases as quickly as you otherwise would. And so I'm encouraging the people of Louisiana, as difficult as this is, and as much as we want to get back to normal, embrace what we're trying to do, because it is the best way forward for you, for your family, for the state. And understand that until such time as there is a vaccine that is administered broadly across the population, this is the new normal that we're in. It's unfortunate, but it's just where we are. But we need to embrace it, make the best out of it, and then we will proceed through this and get back to the day the Lieutenant Governor was talking about, where we have a vibrant economy, where we're setting records again with tourism, where our GDP is the 4th fastest growing in the country, which it was earlier this year. Our revenue was 10% ahead of the forecast because the economy was performing so well. We can get back there again, and we will, but we all have a role to play, and I'm asking you to do that, and I have all the confidence in the world that you will. So thank you very much. We'll see you on Friday.
And that was Governor John Bel Edwards wrapping up today's update on the coronavirus here in Louisiana. Of course, phase 1 going into effect on Friday. As we enter that phase 1, the governor again stressing and encouraging everyone to continue practicing social distancing, wearing masks out in public. He says that's going to be vital in our success as we continue to move forward. We, of course, are going to have all the updates on the latest numbers and all the new details from today's conference on our newscast coming up at 5. We'll return you back to your normal programming.